Hello everyone, my name is Chase Smith and I'm a student here at Excelsior University. Today we will be learning about meningitis. First, let us take a look at the agenda for what all we will be covering in today's discussion. We will go over a little bit about meningitis, the primary microbe responsible for it, the disease process, where in the world it can be found, the timeline when it was first discovered, and how to fight against meningitis. Now, let's get started. When I first started doing research on this topic weeks prior to now, I found this quote from the Mayo Clinic that gave an excellent overview of what meningitis is. Meningitis is an infection and inflammation of the fluid and membrane surrounding the brain and spinal cord. These membranes are called meninges. The inflammation from meningitis typically triggers symptoms such as a headache, fever, and stiff neck. Next, let's dive into the microbe that is responsible for causing meningitis. The microbe we will be reviewing is called Streptococcus pneumoniae. Streptococcus is one of the most common bacteria to be found in adults who have been diagnosed with bacterial meningitis. Streptococcus pneumoniae are lancet-shaped, gram-positive, facilitative, anaerobic bacteria with more than 100 known serotypes. The transmission of S. pneumoniae is seen from human to human contact. This bacteria itself thrives on mucosal membranes of their chosen host. This means they can be spread from someone who is infected with it when they cough or sneeze in your direction or on a surface that you may end up touching. S. pneumonia can move to your lungs, then eventually to your bloodstream, which can lead to meningitis. In 2017, the WHO included S. pneumoniae as one of 12 priority pathogens. The continued high burden of disease and rising rates of resistance to penicillin and other antibiotics have renewed interest in prevention. S. pneumoniae can also be responsible for quite a few different health concerns as well. If the invasion of this bacteria reaches the individual's bloodstream, it can become a life or death situation when it causes meningitis. It is also said that someone who contracts bacterial meningitis may only have up to 24 hours to live. The picture I provided to the right gives an accurate diagram of how this invasion takes place within our bodies. Now let's talk about where this microbe can be found. S. pneumoniae is a highly versatile bacteria. It can be found across the world, not just specifically in one country/state. Scientists have also discovered that this microbe is most prevalent in colder months of the year. This means that S. pneumoniae is most active during the winter and leading into early spring. S. pneumoniae is more common in older adults and infants younger than a year old, whose immune system may not be able to fight off this bacteria. Since it can easily be spread from person to person, this microbe may be able to spread easier in communities where hygiene isn't a priority. Meningitis dates back to a long time ago. Meningitis was first discovered in 1661. Streptococcus pneumoniae has been around for a long period of time as well. It was first discovered back in 1881. Streptococcus pneumoniae causes acute bacterial infection. The bacterium, also called pneumococcus, was first isolated by Lewis in 1881 from the saliva of a patient with rabies. S. pneumonia outbreaks has happened over the years quite frequently across the globe. The most recent outbreak of meningitis happened back in November of 2022 and lasted until January of 2023. The first ever recorded outbreak was in Geneva in 1805 and has happened periodically over the years. Now we're going to discuss a little bit about how the disease process works within the human body from the time S. pneumonia first enters. When the microbe is transmitted to its next susceptible host, it will first become attached to the mucosal membranes and upper respiratory tract. Scientists have discovered that it thrives on sugar to be able to multiply and grow as well. So it can eventually move into the host bloodstream where there's plenty of glucose, which is also a derivative of sugar, that it can use to survive on. Once it has made it into the bloodstream of the body, it can cause numerous issues like pain in the neck, back, and muscles. If it moves to the meninges, that is where it can become fatal within 24 hours, like we discussed earlier. If this microbe travels to the host meninges, that is when they are diagnosed with meningitis. Symptoms of this can include fatigue, irritability, confusion, sleepiness, stiffness, and headaches due to the swelling. Our immune system is one of our body's greatest defenses, but if our immune system is weak due to age or if we have been sick recently, then we can contract meningitis. We see that this makes patients carriers who can pass it on to other people and can even contract it again. But might I add that this is very, very rare for that to take place. Some of you may be wondering how to help prevent meningitis. This is a quote that was said by the CDC back in 2023. Even though that they mentioned in meningitis bacteria, it can also help against all bacterial meningitis. Vaccines can help prevent meningococcal disease, which is any type of illness caused by meningitis bacteria. There are 3 types of meningococcal vaccines available in the United States. Those are the 3. All 11 to 12-year-olds should get the MenACWY vaccine with a booster dose at 16 years old. Teens and young adults 16 through 23 years old also may get MenB vaccine. Those who are getting MenACWY and MenB vaccines at the same visit may instead get a MenABCWY vaccine. CDC also recommends meningococcal vaccination for other children and adults who are at risk for meningococcal disease. Finally, now that y'all have been provided with the information that I've given to you, now let's discuss how to protect yourselves and fight against this disease process. Wash your hands first and foremost. Carefully hand washing helps prevent the spread of germs. Teach children to wash their hands often, especially before eating and after using the toilet. Spending time in a crowded public place or petting animals. Show them how to thoroughly wash and rinse their hands. Practice good hygiene. Don't share drinks, foods, straws, eating utensils, lip balms, or toothbrushes with anyone else. Teach children and teens to avoid sharing these items too. Stay healthy. Maintain your immune system by getting enough rest, exercising regularly, and eating a healthy diet with plenty of fresh fruits, vegetables, and whole grains. Cover your mouth. When you need to cough or sneeze, be sure to cover your mouth and nose. If you're pregnant, take care with food. Reduce your risk of listeria infection by cooking meat, including hot dogs and deli meat, to 165 degrees Fahrenheit. Avoid cheeses made from unpasteurized milk. Choose cheeses that are clearly labeled as being made with pasteurized milk. And now, thank you all for taking time out of your day about learning the disease process and how this microbe attacks the human body.